You suddenly develop a gambling addiction, or your pee turns green after surgery, or what about you start having sex while you're asleep? So, today I'm going to tell you the top 5 weirdest prescription drug side effects that I've heard of from the perspective of a drug scientist. So, let's start with Ambien, the one that you're probably most likely to know. So, you've probably heard stories about people who, like, I don't know, start sleepwalking while they're on Ambien, or do things like reset the alarm sounds for their alarms to Chewbacca sounds to just scare the crap out of yourself when you wake up. But there are some very problematic side effects that occur with Ambien, and specifically can include things like sexsomnia. So sexsomnia is basically where you are asleep and then you start having sex. Now, there are obviously ethical issues associated with this. So you can't really consent because you are asleep, and somebody else cannot consent while they are sleeping as well. This can get people into some legal situations. And so it's an incredibly embarrassing disorder that people don't like to talk about, but it is one that is more likely to occur when you take things like sleeping medication. And they say that there are ways to actually prevent this. So typically it occurs when people are taking very high doses, especially for long periods of time. So maybe weaning yourself off of it for a bit, or maybe trying to take a lower dose and see if it works, that could be beneficial. But as a reminder, always talk to your actual doctor about this. I am PhD, not MD. They also do not recommend taking Ambien with things like alcohol or other sedatives, so with things like anxiety medications. In general, don't take alcohol with other drugs that make you feel tired. It's just a very bad idea, but it's particularly bad when Ambien makes you do some weird stuff and alcohol also makes you do some weird stuff. Number 2, in terms of weirdest side effects, we have phantom odors, which a surprisingly large number of drugs can actually cause. So we're talking about drugs for diabetes, drugs for high cholesterol, proton pump inhibitors, which are for things like acid reflux. All of those can increase the likelihood that you will start to smell random things. And typically it's things like burning sensations. Some people say that it's like burning rubber, that all of a sudden you'll just smell and you'll be like, what, am I near a racetrack? But no, it is a phantom sensation from your actual medication. Sorry, my roosters are all very angry today, so apologies for Masters and Johnson. You'll probably hear at some point too. Not heard Kinsey, and if you understand that theme, I appreciate you. Anyways, they found that all of those drugs seem to increase the likelihood of smelling something that doesn't actually exist, which is also, by the way, a sign of a stroke. So just putting that out there. But they don't actually know why. And it seems like it is more consistent that you would smell a phantom scent if you were on 5 or more medications. So they actually did a survey where they just kind of wandered from people's houses. And then they asked people what medication they were on and had them show them their actual medication prescription bottles, which, why are you trusting some random person who just shows up at your door with that information? I'm not entirely sure. But they found that people above the age of 60 who were on 5 or more medications, of which 1/5 of people above the age of 60 were on 5 or more medications, they were far more likely to have the smell of something that didn't exist. Number 3, pathological yawning, which is, by the way, when you yawn more than 3 times every 15 minutes, which people say is not actually that problematic. They say that it's annoying, but just as annoying as having tingling around an injection site. So pathological yawning might be tied to something with serotonin or dopamine. We're not entirely sure. In fact, we're not entirely sure why we yawn in the first place. And I really like this specific sentence that somebody put in an article about that, because I did that rabbit hole into why we yawn. You know I did. So the scientist said, yet it has not been taught much in med school because no particular physiological significance has been associated with it. I don't know why they sounded so pompous when I try to quote them, but basically they're like, we haven't studied it because it doesn't really matter, because it doesn't seem to be problematic. So because of this, we don't know why people yawn. It could be that it is something linked to an altered state of consciousness. Maybe it has something to do with boredom. Maybe it has something to do with empathy. We have no idea. In any case, it is a relatively rare symptom of antidepressant use, but also seen during opioid withdrawal too, because weirdly opioids make you yawn less. And again, still not interested in why this happens, apparently. Number 4, in terms of strange side effects, is peeing green. And this is different from peeing yellow, like bright yellow, which you'd get for things like vitamin B supplements, or peeing orange, which comes from certain antibiotics. But peeing green comes from certain people going under anesthesia with propofol. So propofol is very commonly used to kind of put somebody under for general anesthesia. And in like a very small amount of cases, we're talking about like 16 that they'd seen before 2015, they found that somebody had green urine. And they're like, actually not a problem. But like it's going to make people worry. It's kind of like how Pepto-Bismol can turn poop black, or things like the Burger King Whopper turn certain people's poop green, and then kind of everybody freaked out for a while. Like, it's just a weird side effect that you probably want to tell people about. Now, on to number 5, which is actually very problematic for people who experience it. Number 5 is basically everything going awry with your dopamine system when you have Parkinson's. So one of the primary drugs that they give to people for Parkinson's is something known as L-Dopa. So Parkinson's by itself is basically like a disorder in which neurons in the specific area of your brain, the area known as the substantia nigra, they basically start to degenerate. So they stop working in that area. And that area is responsible for a lot of our production of dopamine. So if those neurons stop working there, then you won't have as much dopamine. So to counteract those symptoms, people can give things like L-Dopa. So this is a standard treatment for people who have Parkinson's. They basically just take what is known as the precursor to dopamine, so that when it goes into your brain, it'll actually become dopamine, and it will help with some of your dopamine-oriented problems. This increase in dopamine triggers all sorts of problems. So first you have things like, pathological gambling. They see that there's like these disorders related to impulse control. So risky sex, compulsive shopping, compulsive eating, other increases in things like trying new drugs and becoming addicted to them. All of those things that are linked to dopamine, yeah, they're potential side effects of this drug. And you have the other things that are linked to too much dopamine. So things like hallucinations. So we see that there's potentially too much dopamine in people who have schizophrenia, and we see that hallucinations are common in Parkinson's disease too. Also things like mania, again, linked to an increase in dopamine. And punding, which is a common side effect that you see with people who use like coke or speed. What you see with punding is basically like these repetitive behaviors that they can't stop. So just driving around aimlessly, talking without having any desire or actual need to talk. You just keep speaking. Constantly brushing your hair or sorting household items. All of those are punding behaviors, and all of those are linked to an increase of dopamine, and so you see it with this L-Dopa treatment too. So in this case, at least, we know why these side effects appear. You are giving somebody dopamine, and with that comes all of those side effects. And that's true of pretty much every other drug too. When you're taking something to treat one thing, that doesn't mean that it only works on those types of receptors. So if you are taking cannabis to help with pain relief, it is still working on those other receptors that make you want to eat more or make you want to sleep more. Something like nicotine might help with things like learning and memory by working on the acetylcholine system, but it's also going to mess with your motor symptoms too, make you want to move more, give you a stimulant-like effect. With every set of therapeutic effects, there is a kind of equal and opposite side effect. Some of them are stranger than others.